My name is Maggie Aboso. I'm infection control and prevention nurse at Mercy Medical Center. I'm here today to talk about proper way to don and doff PPE, or rather proper way to wear and take off personal protective equipment, more so now as we take care of patients that have the COVID-19. As healthcare workers, as fast line responders, as people tasked with caring for people that may come to us with any infectious process, it is very important how we wear and we take off our PPE. So I have myself my gown, my mask, and my face shield. First thing out of this whole process is I need to hand sanitize before I wear any of that. So because I have my hand sanitizer with me, the proper process of cleaning hands, I might motion to say is make sure the tops, the layers, the webs of your hands are appropriately cleansed, and then also spend the time making sure that the tips of your fingernails are really very well moistened, because that means that you've completely cleansed every aspect and all areas of your hands. Once we finished hand sanitizing, the next thing I'm going to put on is my gown. There's different layers of gowns, but the one key thing to remember about the gowns is that they need to be not permeable, so they are waterproof in a sense, and they act as that level of protection between yourself and your clothes and everything that you're coming in contact with. All gowns come in different formats, but they need to be appropriately secured around you. If there are straps, then they need to be very well tied and secured. They shouldn't be worn and left with the back flapping in the wind. So this particular gown that I'm wearing has the side at the bottom, and then it also has a Velcro at the top, and I have to make sure that that is appropriately secured. The next thing I'm going to wear is my face mask, and it is very important to look at the face mask. You can see the top of it has a little metallic clip. This should be really folded around the bridge of your nose, because you want that to be a snag fit. And then the bottom has nothing. The inside is colored white and the outside is yellow. There's many different colors of the masks, but the key to remember is which side is inside and which side is out. And in this case, yellow is on the outside and the white is on the inside. I put it on around my ears and make sure that I'm also securing this around the bridge of my nose and the bottom, making sure that the chin is tucked in, because that's how I'm making sure I have a really nice tight fit. For everything that people wear, whether it be a regular surgical mask or an N95, the key is to make sure that fit is nice and proper. Otherwise, it doesn't matter which mask you're wearing. If you don't have a proper seal, then you're really just exposing yourself to whatever elements that we're trying to protect while wearing the PPE. The next thing I wear is the face shield, and this one goes on securely around my face, and now I am amply protected. The last thing that I wear is my gloves. The key to remember is this particular mask gown has this sort of fasteners around my wrist. When I wear my gloves, I have to make sure that they go well above the sleeves of the gown, because that way there is no gap between the gown and my gloves, and basically my hands are very well protected. And I'm going to do the same thing for this. Pull it well above where the gown ends, and that way ensures that I am amply protected. And I have to make sure that I do the same thing. Now, when giving care to the patient, the front part of any gown is usually what's covered, and most gowns you'll find that the back is open, other than it being very well secured. The course of my care, my hands are the ones that are coming in contact with all kinds of different organisms and contamination. So when it's time to take off my PPE, I'm going to be very mindful of the fact that my gloves will be dirty, my gown is going to be dirty. So all my doffing process will be keyed on making sure none of this ends up contaminating any other piece of my body. The first thing that comes off when I've taken care of a patient and I'm ready to come out of all this PPE is the gown and the gloves. I have to be mindful to make sure that the inside of the gown is clean, the inside of my gloves are clean, so those are the parts that I will make sure if I'm going to come in contact with anything, that will be what that I touch. So in this case, because this was very well secured in the back, I will take it off, being mindful not to contaminate myself, because the top is Velcroed, I may not necessarily have to reach into it to open it. And now I'm paying attention that I'm pulling it all away from me and wrapping it into itself in a sense. But the pieces that are being left on the outer is the inside of the gown, which in essence was clean. I will continue to roll it all into itself. In most instances, this gown is very big, so I can't really fold it into my gloves. But you can see the inside of the gown is touching my glove and the inside of my glove, and I'm trying my best not to contaminate myself. I pull that first set of gloves out, and then I do the same thing. I use my finger to reach and pull the inside of the other glove. Once that comes out, I'm going to reach for my hand sanitizer and clean my hands, because I want to make sure when I reach for my face, my hands are clean. I want to make sure that I'm guaranteeing at no point am I going to contaminate my face. Once I feel that my hands have been appropriately cleansed, I've allowed the hand sanitizer to dry off of my hands in my rubbing motion. Then I reach for the face shield and I take it off gradually. This is designed in a way that it can be wiped down and reused over and over and over. Because the top of it is made out of 3D, then it's plastic, then we have the ability to really cleanse it. There's some that comes with plastic or fabric that makes it harder to cleanse them. Once I take that and I put it down, again, I'm going to cleanse my hands because that was on the outside and had that risk of having been contaminated while I was in that care of that patient. Once I have cleansed my hands again a second time, I reach for my mask. But the key to remember is you're reaching for it with those little straps and pulling the mask away from you. At no point when you're taking off that mask should it touch your face. We know, in essence, I had 2 layers because I had the face shield and I had this. But the key to remember is at all points, anytime you want to take off the mask, is reach for the ear loops behind the ear and then take it off. A surgical mask has been designed in such a way that if I wear it and secure it around my face and don't touch it throughout the course of the day, I'm able to wear it for an extended period of time. If I touch or mess around with it, or if it becomes moist, if it becomes stained, then that is a good opportunity for me to take it out and change it. But there is no specific time frame where you can say after every hour, take off your mask. As long as I've decided to wear it and keep it on my face all day, if I'm not a talker that ends up spitting or whatever happens, that my mask is guaranteed to stay intact and isn't moist, I can keep it on for my entire shift, which is an 8-hour shift. As far as N95 goes, you don't generally need that for patients that are COVID positive, as long as you're not doing a certain number of procedures. Anyone that's getting suction, anyone that's getting intubated, anyone that's getting high flow treatment, anyone that's getting any of those respiratory treatments, those are the type of patients that you need to wear an N95 for. But if I'm just doing general care or for the specific patients who already are COVID positive but aren't receiving any of those procedures, a surgical mask and a face shield is ample protection for me as I care for that patient.